I welcome my dear students, my dear colleagues, juniors, and few of my seniors who are watching this channel. So, how to crack the PLAB exam? The PLAB exam is for practicing for the United Kingdom to practice at UK. So, there are a lot of students who asked, like, please give a best video, sir, so that rather than running behind a coaching for a PLAB, we want some guidance so that we can read. So when they ask such a question, the first person who came into my mind is my dear batchmate, who is a good administrator, Dr. Pratap Neelakantan, who is a consultant hematologist at United Kingdom. And I request Dr. Pratap to introduce himself and to further proceed about this session. How to crack PLAB exam, the exam for practicing at the United Kingdom. Thank you. Welcome, Dr. Pratap Neelakantan.
Thanks, Anton. Thank you very much for the invite, and it's a real pleasure to be speaking to people to share knowledge. And if this can be helpful to a few people, then it's great. I'm a consultant hematologist. I came to the UK about 16 years ago, straight from MBBS, and did PLAB, and then went through the higher specialist training and did my research in UK. I'm now a practicing hematologist at Reading, which is a town in UK, and at Oxford, and I do both clinical hematology and malignant hematology. And I'm quite happy to talk about things. If there are questions people want to ask, then I'm quite happy to digress, go down those questions, because it's important to answer what you want rather than what I want to say. I can start off, Anton. I'm happy for you to lead me in a particular direction.
Yes, so, exactly, Pratap. Exactly. Sure, Pratap. So as a first question is, so as a PLAB is a exam to practice at to crack the PLAB to practice at United Kingdom. This most of the people knows. So for people doesn't know, PLAB is the licensing exam to practice at United Kingdom. So first question is like, by what time a student can take PLAB exam? For example, United States medical licensing exam step 1 can be taken by a prefinal students itself. Okay. But PLAB exam, when the undergraduate students can take, so I think that may be the first question you can answer, Pratap.
Okay, there's slight differences between USMLE and PLAB. USMLE, you give those exams to get into a residency, and both the graduates in US and graduates all over the world take the exams. So you can do that even before the final exam. But the difference in PLAB is you need your final exam certificate and a pass in final year to be able to get into PLAB. So the way you do it is you first give an English exam before doing PLAB. And there are a number of English exams you can give. The most common ones in UK that is recognized by both the General Medical Council in UK and the Home Office for visa purposes are exams called Ielts and OET. OET is Occupational English Test, or IELTS is a very common exam. It's been there for a number of years. And the specific IELTS that is recognized is called IELTS VIS, UK VIS. That's for UK visa purposes. So you need to do one of these two exams. And if you want to decide which is the better exam to do, OET is becoming more and more popular these days. OET is an occupational English test. Primarily, it was designed by Australian medical licensing authorities. It was then taken up by New Zealand, Canada, UK, and now USA has started to take up OET. So at least a few states in US have started to accept OET as a common exam, which recognizes you're good at English. And these exams have 4 common threads. You have to read, write, listen, and speak. So it's important to do this exam. Probably you can do this exam either in your final year or just after you finish your final year. Validity for this exam is 2 years.
Okay.
So you need a final exams pass certificate and an IELTS or an OET pass certificate to apply for PLAB 1. And because the validity is 2 years, ideally you can do it during your house surgency. That's the best time to do a PLAB. And if you do it at about 6 months time point, you book your time slot for your exams. It gives you those 6 months to get your IELTS or OET and then prepare for PLAB and then do your PLAB. And then after you finish your PLAB 1, you will then be eligible for doing PLAB 2. PLAB 1 can be done in India. There are
Okay.
4, you may ask those questions along down that, but this is the time scales for doing PLAB.
Exactly, Pratap. As you told, IELTS or OETs, either of these two are important for visa purpose and practice, and to assess the English knowledge by the Indians or foreigners, by the UK people or other country people. So for that, I can personally, my side, I can suggest my dear undergraduate student is, many of us, as when I think about myself during my undergraduate days, we are not good in reading habit. We, as in a hostel, we used to spend time late night and then getting up early, not early, getting up late, and in 10-15 minutes we get ready and go to the ward or units. Okay, so I request dear UG students, if whoever are watching, please develop the habit of reading newspaper. It may be a just to start with, I can say Times of India or the Indian Express, where the flow is really good. Or when you are really good in English, you can start reading Hindu also, because I am not a very good in English. But this I feel like the Times of India or the what to say, the Hindu is advanced. The Times of India or Indian Express is anybody can read, so that the grammar mistake or the habit of reading will be like encouraged, and you will, once you start doing things, you will learn a lot of things, because you will find out what is the answer. Google is there in your hand, you will find out what is the exact meaning for a word. Like that you can develop, my dear students, because when you want to read something and you want to crack is unnecessary stress. Rather, I always tell, develop whatever the things to be, whatever the knowledge which you need. For that, you start doing from the first MBBS. You want to go as a practice at the UK, you are a first year student, please start reading English paper along with the medicine also, so that IELTS or OET or NET which comes in future will not be a tough thing for you. As you rightly said, Pratap, PLAB 1 can be taken in India. And before that, can you open about one or two point? Is what is the way to crack IELTS? What is the website or something like that? How to be done online or offline? Please throw some lights on it.
Okay, Anton, as you rightly said, the way to prepare for these exams is to prepare over a period of time. And it's important to start reading simple things. And when you analyze how people have done IELTS, especially the international medical graduates, there's quite a lot of data that's available in the General Medical Council website. And in the IELTS forums, where Indians, we probably struggle a bit, are two main things. That's surprising to note. It's writing and listening. Apparently, we do very well in speaking and reading. And it's sometimes we are worried about the accent, whether we'll be able to understand what people say. The common accents which come up in these exams are either Australian or British or American. One of these three usually comes. And they speak very slowly. So don't worry about these accents. If you listen to enough, like for example, what I used to do before I did this exam was watch a lot of BBC programs. And it's a good way of knowing or getting used to their accents. And it's not different at all. It is not difficult at all. It's very similar to what you and I speak, but they kind of tend to speak in a grammatically correct way because that's their mother tongue. That's no big deal. If we just need to be carefully listening to what they say, and usually the way they speak in these exams is very, very slow, so most of us will understand. And writing is something which people find it difficult because, like, as medical students or as house surgeons, as PGs, we write case sheets, and sometimes we write in shortened formats for a lot of things. We don't need to write a grammatically correct page, and that's something we probably need to get used to. Writing little essays, writing certain notes, it's just getting used to writing. You don't even have to have people to correct it. It's writing and then reading yourself. And practicing that probably for about 2 to 3 weeks is good enough before an exam. Generally, they say a month and a half preparation for IELTS, listening to programs, and then writing a bit is what is recommended. And there are plenty of free material available for IELTS. You don't really have to go to any courses. As Anton says, read newspapers. You can probably read something in a newspaper and just write a column about it, write a blog about it. Get used to writing like that. And probably listening to BBC. And these are the things I'd recommend for you to clear IELTS or OET.
Exactly, Pratap. Now, so many new laws are coming. Students can read those laws and they can put a blog about the ideas, because doctors are well educated. Doctors also should know about politics. So they can, as a doctor, we can read, we can understand. We are most educated. I can say the best candidate so far is coming into the field are doctors, not IAS or IPS or other profession. So as a doctor, we should know. I always tell, learn politics, do politics. You also know what is happening in and around, so that as you rightly told, understand things what is happening and write a blog and let, in a simple way, let everybody knows about it. And also it is an easy way you can crack IELTS or OET. Thank you, Pratap. And as you told, there are two exams, I think, PLAB 1, PLAB 2. PLAB 1 can be taken in India. PLAB 1, if I understand rightly, PLAB 1 can be taken immediately after the final MBBS, once pass being obtained. It is no need to wait for, I think, degree certificate. So for a PLAB 1, pass certificate for our final MBBS mark sheet or a provision certificate is enough, I think. And the next, PLAB 2. Can you please first enlighten about PLAB 1, how to prepare? What is a book to be book of choice for PLAB 1?
Okay. As Anton says, you need a provisional pass certificate to apply for PLAB 1. Once you've got your English, your provisional pass certificate, that's enough. You can do it during your internship. And then, the PLAB 1 is an exam where you have about 180 MCQs, and it's a 3-hour exam, roughly about 1 minute per question. And the common subjects that are covered are all the subjects you do in your MBBS, right from first year to final year. They don't discriminate between, they don't give a weightage to just the final year subjects. It's a licensing exam at the level of a house surgeon. So they call it foundation year. So they want you to have some knowledge in pretty much everything, but they are slightly more clinically weighted, where your medicine, surgery, OBG, pediatrics, psychiatry, they will probably have a higher weightage than anatomy, physiology, biochemistry. It's going to have less of basic science, slightly more of clinical subjects. And a lot of PLAB exams nowadays, they're concentrating on ethics, communication, and behavior, values. So here they actually have that as a part of their curriculum, medical graduates. In the past, PLAB exam used to be only for international graduates, but from next year onwards, the name of the PLAB exam will change slightly to make it very similar to a USMLE. It will be called as a medical licensing exam, and the same exam will be given by all UK graduates and all international graduates. So they are trying to bring the curriculum together, and this is where the focus is going. So there are quite a few books available online that you can get, which do a mock exam, or which gives you practice questions for PLAB 1. And they generally used to say, but doing about 1,500 to 2,000 questions as a practice is what you need to do, and make sure you get into the mode to get that exam. And there are about 3 or 4 textbooks which are available, and any of those textbooks are, they're probably at the same level. One thing is not better than the other, and brushing up on the knowledge that you've gained in your final year is quite useful. And one key thing is, every year it's important to know what the curriculum for PLAB is, and the General Medical Council updates it each year. And it's very important to look at that website and see what is their curriculum concentrating on. And sometimes knowing, as Anton probably would tell you much more about it, exam is all about the knack of cracking it. You have to learn to play the game that they want you to play. So find out what their curriculum is, find out what they're trying to concentrate on, and preparing along those lines is going to give you the best opportunity to clear the exam. And that's PLAB 1.
Exactly,
And
Pratap. But I remember during my house surgeon days, our final year time, our seniors used to have a Oxford Handbook of Medicine. Most of them will try to have that one book. They read it much. I've seen they cracked the PLAB exam. Many have cracked Ames exam. Many have cracked with the Oxford Handbook with All India exam, Tamil Nadu PG exam. I used to wonder actually. So whether that book is Bible for everything, or their knowledge is so immense, they're able to crack so many things. Please enlighten whether that's a book still followed for PLAB 1 media.
So there is an Oxford Handbook of Clinical Medicine, and similarly an Oxford Handbook for Surgery, Pediatrics, and an Oxford Handbook for foundation year doctors. So most of the Oxford textbooks have fairly common basis, and even though the book appears very small, it's a very comprehensive book. And I've heard a lot of our postgraduates in medicine back home use Oxford Handbook during their first years, because it's a very, very knowledgeable, comprehensive book, updated every year. And Oxford Handbooks are like a Bible for foundation doctors here. And apart from the Oxford Handbooks, probably buying a question bank book for extended matching questions. It's available on Amazon India, where you can get the extended matching questions books.
So topic of the book itself is extended matching question.
Yeah, so the heading of the book is literally extended matching questions for PLAB 1. And Oxford Handbook of Clinical Medicine is, these two books are probably enough to crack PLAB exam. You don't even have to completely do cover to cover of Oxford Handbook of Clinical Medicine. It's important to know the common topics, and this is why I said it's good to look at what the curriculum of that year's PLAB is. The GMC updates it regularly, and those curriculums make sure you're absolutely thorough in the Oxford Handbooks.
Exactly, and but still, I have seen some of the topics like very concise and what is need exactly for seeing the patient. That's so the Oxford Handbook of Medicine. I have not read completely. I can say like I might have read 5-10 pages by getting books from the seniors or colleagues like you when you people are preparing. I request audience to note as the point, which is that book is available in the Amazon and Oxford textbook of medicine, which is a handbook, a small book, I think, which costs around 500-600 rupees. Definitely will be helpful for you if somebody is really want to become crack UK exam, PLAB exam. And this is all about PLAB 1, as you rightly said, Pratap. But what about PLAB 2? Can you please enlighten about PLAB 2? PLAB 1, as you said rightly, can be taken in India. And the standard of book is Oxford Handbook and extended matching book, which is available in Amazon. And what is, please enlighten about PLAB 2, what is the exam, where to be taken, what is the book to be prepared? Please enlighten it, Pratap.
Okay, PLAB 2 is an exam which you can only take in the UK. PLAB 1 happens about 4 times a year in India, but 2 is only in the UK. And the PLAB 2 is an OSCE exam. OSCE is objective structured clinical examination, where you basically have about 15 stations being 15 rooms. So a candidate goes from one room to another. Each station is about 10 minutes. You get about a minute and a half, about 90 seconds to go outside the room, read the question, and then you enter the room. You have 8 minutes. Like that, you'll go through 15 stations, and the exam is about 3 hours. And then at the end of the exam, yes, you get a result. So the way OSCE happens is you go in and you are either given a scenario. There will be a patient in front of you where they might ask you things like, can you perform a cardiovascular examination? Can you perform a knee examination? Can you, these are examination scenarios. And there'll be scenarios where an actor will be there. You have to take a history or break some bad news. They may have a diagnosis of cancer, or they may be quite angry with you. A lot of themes coming out in the PLAB 2 exams in the last few years is all about communication skills, ethics, how do you behave with the patient. So it's important to understand how things are done in this country, how is it evaluated in this country. And then the third type of scenario that can be in an OSCE exam is mannequins, where they may ask you to demonstrate examination skills, or how do you cannulate, how do you put in a cannula in an arm, how do you take blood pressure, and they might ask you to demonstrate how do you use an instrument like how a pulmonary function test. So these are things that are kept in the PLAB 2 stations, where you go through them one by one. How do you prepare for this? In some ways, you have to understand how things are done in the UK to be able to prepare for this. There are ways in which you can prepare for PLAB 2 there are plenty of YouTube videos, which not only General Medical Council has advised, but private videos available on YouTube, which tells you what are the various ways in which these stations are marked. And it's important to understand them very well before you get into it. And I would recommend having some practice of mock exams. In India, there aren't many centers offering PLAB 2 coaching. There's one in New Delhi, I think, which offers PLAB 2 coaching in person, and the rest of the PLAB 2 coaching happens in UK. So the way you do it is you clear your IELTS, you clear your PLAB exam, PLAB 1 exam, and then you book your PLAB 2 after your internship, if that's what you're doing. Then you come to UK about a month before you take your PLAB 2 exam, 1 to 1.5 months before you take your exam. And the exam is only held in one center, Manchester in UK. Before it used to be held in London, but now they moved to Manchester. So you come there, and there are 1 or 2 agencies which offer a PLAB 2 coaching. And it's best you do the in-person coaching there, where you sit down. They will have a virtual demonstration of how these stations are. They'll give you lots of practice on how OSCEs are done, what are being examined in those OSCEs, and how do you talk to these people. That is one way of doing it. The other way of doing it is coming to UK and then doing an attachment in a hospital. Attachment is basically a placement in a hospital that you do for a month and a half. You don't get paid for it, but you attend the wards, you go to clinics, you sit and look at what people do, how do they practice medicine in UK. And for this, my biggest recommendation would be to use the strength of your alumni associations. Every college will have a huge strength of alumni, and your alumni can guide you and get you a placement or an attachment in a hospital, and it's invaluable to cracking these exams. It's not
Exactly,
only
Pratap. Exactly, Pratap. As one word with the alumni, I still remember about more about Stanley alumni. We'll discuss. And one point which you have told in PLAB 2 as is more OSCE type, and it is more mannequin or situation is given. So how to react as now the system which definitely MBBS student at India or any medical student should know is how to handle the patient. That is most important. Still, I remember the days during my final MBBS period. One person with the bronchopneumonia came. Everybody used to slap on the back. Yeah, hear the sound. Hear the sound. Hear. What is this? This is not the way. See, patients are available to be learned and to we acquire knowledge, and we want to deliver it to the our future patients. That's how the system. But nothing should be taken into granted. But still, I remember I was a third year student. One of the final year student was like final year girl student was like just cracking the back again and again. I was telling, why are you doing it again and again? That ma'am still remember what she told. You come to final year, then you will understand why I am doing that. But the one which I wanted to give as an input for my dear students are, please remember, patients are not just signs and symptoms. As we read, see, just think our parent is sitting in front of you and you are examining them. Will you allow 10 people to just tap on her back or tap on her chest? Nobody will allow. Okay. So this is the thing which everyone, what I will generally perceive is, as a OSCE, as a PLAB 2, which is OSCE type, or is almost like what the sense a doctor has for treating a patient. Not only the knowledge is important, how you exhibit your knowledge to the patient. When the patient is really stressed, when the patient has develops a complication for ampicillin, some complication happens, okay, Steven Johnson syndrome happens, the attenders will be angry, patient will be angry. It is up to everything soft enough to explain it rightly. That for that, in a bottom line, I can tell you, you develop a habit. I am examining this patient. This patient is my spouse. This patient is my girlfriend. This patient is my boyfriend. How much respect I will give them? Or this patient is my brother. This patient is my parent. If that kind of attention is given for the patient, I personally feel OSCE will not be a tough thing to face. No need to be taught or learned anywhere. But still, you have to go for a coaching. That is a different scenario. But when the what to say is, when you understand the pain of the patient and you deliver it, that is the OSCE. The USMLE Step 2 CS also does the same. Here, the PLAB 2 is doing the same. And nicely enlightened, Pratap. And to be specific, in PLAB 2, how many times in a year PLAB 2 is conducted? How many times in a year PLAB 1 is conducted? How many times in a year IELTS or OET is being conducted?
Anton, just to add to the same point that you mentioned, OSCE is all about how you behave with the patient. And Anton put it beautifully. It's all about how you make a patient feel. You need to make sure that the patient is at ease. You treat them in a very cordial manner. Your patient has the right to be angry. How do you deal with the patient? How do you deal with those issues? Yes, they are looking to examine your clinical skills. But what is more important is, how do you treat your patient? And people sometimes fail because they treat the patients badly, not because they may not know the answer to a very specific question. Like, how do you examine a a medial collateral ligament? If you fail to identify that, or a cruciate ligament injury, you won't be failed for that. But you might be failed if you treat a patient very badly. If you touch a patient or push a patient, examine the abdomen where they have got abdominal pain and press deep in without even telling the patient or asking the patient how he feels. So it's very important to understand that for OSCEs. With regards to Anton's question about IELTS or OET can be done, the exams are conducted all the time, many times in a month, all throughout the year. PLAB 1 is conducted 4 times in a year in most of the major cities in India. At the moment, it's there in Chennai, Bangalore, Hyderabad, Delhi, Bombay, and Calcutta. I think these 6 centers offer PLAB 1 exams 4 times in a year. PLAB 2 happens every month. So almost 10 to 12 times in a year, you have PLAB 2 exams. So you have to clear your IELTS 2, your PLAB 1, and then apply for PLAB 2. So it as long as you space it out, and you probably need to give a few months between your 1 and 2, you should be able to do it all within a matter of about 6 to 8 months. You should be able to do all 3 exams if you plan it well.
Exactly, Pratap. So once a PLAB 2 is cleared, so what next to be done, Pratap?
Okay. As Anton mentioned at the beginning, PLAB 2 makes you eligible to practice medicine in UK at any level. It just makes sure the degree you've got in a foreign country is on par with the degree or MBBS that you've got in UK. And then you have to register yourself with the General Medical Council. It's like the Indian Medical Council. After you finish your MBBS, when you've got your provisional certificates, you registered with your respective state medical council and get a provisional registration. Like that, General Medical Council gives you a provisional registration. After you worked for 1 whole year, then it's converted to a full registration. So with the provisional registration, what you can do is you can then apply for jobs. And the application for jobs is an online process where you complete your application. And it's important to understand what is the job you apply for, whether you fulfill the criteria. And this is where talking to the people who are there, who are in that field. So it's important to identify what field you want to come into. For people fresh after MBBS, it's less of an issue. You will have a wide area you can apply for. But people who've done post-graduation, then they, for example, a medicine, MD medicine in India, you may only want to apply for internal medicine. So it's important to know at what level you want to apply, and then tailor your jobs to your qualifications. You complete the application, and then you will be called for an interview, and how you answer in the interview will then get you a job. But I would always recommend probably doing a period of attachment after your PLAB 2 exam for a month or 2 months to understand how the system works here, because
Exactly.
it's all about how you present yourself. There is no question about your knowledge. If you
Exactly,
finish one,
Pratap. Exactly. So once IELTS PLAB 1, PLAB 2 is cleared, next step is registration at General Medical Council. Am I right?
yeah, GMC,
General
General
Medical
Medical.
Council. Once a doctor has registered at GMC, next they will get a provisional registration certificate, and that can be valid for 1 year. Once 1 year practice being done, they will get a regular that is a permanent registration certificate for practicing at UK.
Yeah.
But there is a question always come even after registering the PLAB 2. Clearing the PLAB 2, the General Medical Council, they take long time to give a provisional registration certificate. Is it happening still now, Dr. Pratap?
It's variable. It may have happened in the past due to backlogs, but it's generally not an issue. You should get it fairly soon. So it's not a usual issue.
So once GMC done, registration done, professional being obtained, then you give a observership or you attach, you wait for an interview. The interview and all, how as a doctor you express yourself to the person, HR person who is interviewing you, that it is not objective, it is subjective. So,
well, Anton,
yes.
if I can just interrupt that, the interview is dependent on the higher up you go. Like for example, you go right to a consultant level interview, they won't quiz you on clinical knowledge. But if you're applying for, immediately after MBBS, then there will be some clinical scenarios in the interview, and it will be not just a HR interview. It will be both clinical, and HR person is mainly there to make sure the process is fair, and they'll ask you questions like about your visa status, about your whether your CV is right or not. But the clinical scenarios will be they'll have a lot of weightage early on. As you go higher up the ladder, when you are at the consultant level, then it's all about a general interview, the nature of person you are. So it's a bit of both.
Yeah. Okay. But more, it is not. It's again, it is a subjective rather than no ask your objective. That's
No. Yeah.
that I want to convey. Yeah, I understand, Pratap.
They won't ask
So
you to do anything as a practical thing. It's all about a face-to-face session. Some interviews, they may ask you to give a presentation for 5-10 minutes on a topic that they will give you much before. But most interviews are about an hour session where you'll have 2 or 3 rooms, and one room they'll quiz you about all your experience. Another room will be a clinical scenario, and the third room can be about ethics. So these are the types of interviews that are happening in UK right now.
as you rightly pointed, the word ethics, which is very important, especially in India, the ethics is the biggest question mark. Ethics and etiquette are biggest question mark, which I am seeing since the last 10 years. There is no etiquette, but at least for to crack the exam, people in India should learn ethics and the etiquette, definitely. Because why I want to tell is the system in India is different. The system in UK is definitely different. The approach, the outcome, everything is different. There, really, people praises others. I feel here still the people fear to praise even a colleague. So even a person done a wonderful job as a etiquette point of view, as any good person will appreciate. But there is no etiquette. I can say zero etiquette which is prevailing in our country. I do not know why it is. Actually, how the etiquette at UK, Pratap? Is it looking the same, or the Indian scenario, or as I perceive it is good?
Well, the way the system is totally different. Imagine if in the entire Indian system was only government practice for the entire country, and you're not worried about patients moving from one person to another. You're not worried about competition. So it's very different in that sense. So you don't put another colleague down. You don't talk ill of what other people have done, because here most things, almost everything happens according to protocol, according to guidelines, according to the best evidence, if you can call it that. Sometimes you don't have evidence in what you do. So practice does not vary very much from one corner of the country to another corner. So there is less chances for you to tell. But clearly, yes, mistakes are made. things happen, in which case people will be entitled to being angry, in which case you have to address it in a very professional manner. So, as Anton pointed out, somebody could come with an amoxicillin allergy. So what you don't do it is, I think that doctor was very wrong in giving you amoxicillin. You have to address the problem, talk to the patient, understand their concerns, and move on, rather than harper or keep talking about why something was done wrong.
Exactly, Pratap. The point which I want to bring actually is, see, people in India, the practitioners in India, when they are good practitioners, when there is some kind of competition or some person with a better specialty comes into the practice, especially in the tier 2, tier 3 cities, they think a lot about them. They want to destroy them. That's how is exactly prevailing. I am not exaggerating. I have practiced in Viluppuram for 3 years as a laparoscopic, endoscopic surgeon, as a general surgeon. By 27, 28, I learned upper GI scopy, colonoscopy, sigmoidoscopy, bronchoscopy, laparoscopy. So practitioners at one of my beloved practitioner at Viluppuram is annoyed, and how he destroyed my name happened. And this why I point to address here to my dear undergraduate students or my dear listeners are, I have seen people at UK, they are fit, they are healthy, they are physically healthy, they are mentally healthy. One, the paying system, which is universal everywhere for all practitioners. Number two, as you rightly pointed, it is a completely program taken by the government. There is no private practice. So doctors have enough time to take care of the health. Doctors have enough time to do exercise. Doctors have enough time to relax. That is really lagging in Indian system of practice. I think the lifestyle is one thing which is I really want to appreciate. The people who like some of our batchmates who are really obese. Even you, Pratap, when you are in our college, how obese you are. Now you've become very fit. I've seen Aruna become very fit at UK. Malarvili become very fit at UK, which means you have us plenty of time to take care of your health, and others also are taking care of the health. That also becomes contagious to all of us. I think that is the one thing which I really want to appreciate, Pratap.
I don't know whether to say thank you or not after calling me obese. Yes.
Yeah, initially you are like that, my dear, but you definitely were when you came for the batchmate, your
No, no.
weight has
No,
considerably lost. Your
what you
look.
say is true, because here, if you talk about work-life balance, there's definitely a better work-life balance here. You have a job from 9 to 5, but yes, you start at 8 and maybe finish at 6 in the evening, but still that time after that is yours. When you go home after work, unless you're on call, people don't call you. And if you are doing weekends, you might do one weekend in 4 weeks or one weekend in 5 weeks. The rest of the weekends are for you. So the Saturday and Sunday are your time. Definitely people in India work a lot more hours than people in the UK, and that's the undeniable fact. So for people looking for, and it's about how much you want to do. Like in your work hours, you sit and do your clinical work. Outside your work hours, you might want to do research, you might want to do academic work, but that's up to what you want to do. But you definitely have that additional amount of time that you can spend with your family or do things for yourself. So there is a better work-life balance in UK definitely compared to India.
Thank you, Pratap. And as you told about the alumni, I have heard a lot about alumni of Stanley Medical College. Some of the one of my batchmates stayed for almost 1 year. The alumni supported him. That is one thing. Whoever is watching here have to understand. Some of the students might be from new colleges, where if you go to UK, start your alumni, support your juniors when they come to the place for to the UK for cracking the exam or planning for a settlement there. That's one of the biggest thing. I used to think a lot about Stanley alumni who are in UK. Can you enlighten any other alumni really doing a good job in addition to the Stanley and the Kilpack alumni, Pratap?
I think off late, Anton, I think KMC alumni is probably the strongest one in UK at the moment, or something similar to other medical colleges. From what I know, Madras Medical College, Stanley, KMC, even Ramachandra, and Tanjavur Medical College, Madurai, they all have very strong alumni. Almost every college Nowadays, with the advent of social media, WhatsApp, and other forms of communication, they've established a very strong network. I cannot overstate the importance of having support from your alumni group. It's not just about help with accommodation or help with it's about guiding you through every step of the process, helping you get an attachment, helping you find the right job. It's about mentorship, talking to them in difficult circumstances. You need people out there to support you, and nothing better than an alumni. They've gone through the same thing as you. The struggles that they've gone through, nobody else can understand it better. Almost every college has a very strong alumni group in UK.
Exactly, Pratap. I really wanted to bring the point here because many doesn't know the value of seniors or juniors, value of interaction. Many MBBS student has always like a 8th standard student or 9th standard student. Still, I got a lot of input from many professors. The students of first year, second year, third year, I do not know. They are like a robots. They read, they go out, they don't value themselves. They don't interact much to the teachers. Still, our microbiology professor, Dr. Ravi sir, you know very well how much they interact to us, how much still I am interacting with him. See, that interaction is very important, very vital. At the end of 5.5 years, yeah, I want to go to UK. Where is my alumni? Don't search for your alumni. Okay, being alumni, strengthen your alumni. Still, our batchmate Sridhar used to strengthen our alumni since our first year. Do you remember, Pratap? That is the
Absolutely.
spirit. That is the spirit a student should have. This is my college. This is my batchmate. This is my senior. These are my professors. I will really will live nicely with them. I will enjoy to have to be with them. That energy definitely wanted actually at this point of time, my dear friends. So I wanted to bring that point here, and as everyone wants, Pratap, as a one point whether MBB after finishing MBBS to enter into the PLAB UK, or after doing a MS or MCH to enter into the UK, and what is the pay if after MBBS a person enters, or as a consultant a person enters into the UK?
Okay. In the past, the way visas were handed out in the UK, it was quite good for people immediately after MBBS to come. That is becoming slightly more difficult. So if in terms of, you can still apply for foundation programs, internal medicine training, but it's becoming slightly more difficult. From next year, I think they're going to open up more, similar to what it used to be about 15 years ago. So there will be a lot more opportunities for fresh graduates to come, where it is more easier to come, or amongst the various groups, is after your first post graduation. Like once you finish your MD or MS, you can come for the first few years under the MTI, Medical Training Initiative scheme, or apply for higher specialist training directly from India. Every year, the competition varies between different specialties, and the most common specialties where people are able to get jobs in the UK are general medicine, pediatrics, psychiatry. These have always been the most commonest, and emergency medicine. These are specialties where there is always opportunities. How much can a person expect to earn coming to UK if you're straight out of MBBS at 23 years of age? You'll earn something like 30 to 40,000 pounds in UK per year. That's probably about 2,000 to 2,005, probably I'd say about 2,500 pounds per month. What does it mean in Indian currency? It's probably about 2 to 2.25 lakhs after house urgency. You might at best spend about 1,000 pounds, 1,200, 1,300 pounds a month. So you'll save about 1,000 pounds at least a month at a house urgency level. And as you go higher up, after an MD degree, when you come here, your salary will be around 40 to 50,000 pounds. And similarly, if you come here with a family, it depends on where you live. You live in London, living costs are more. You live elsewhere in the country, living costs are less. You might require on an average about 15 to 1,800 pounds, 1,500 to 1,800 pounds to live a comfortable life. And you will probably have about 3,000 pounds as salary when you come. So doctors are quite well paid in this country. So you will probably never have a scenario where earning and spending will be a problem. So as you go higher up, that's where your salary becomes lucrative. But until you get to a position where you're at a consultant level, salary is quite good. It's not, you won't be able to earn a lot, but it is more than enough.
Pratap, voice is breaking, Pratap. Pratap, voice is breaking. Some network issues, I think, Pratap.
Can you hear me now?
Yeah, now it is okay.
Okay. So at both immediately after MBBS or after masters, you will probably earn about £1,000 more than what you will probably spend on an average month. So you will get to save, and as you go to a consultant level, the salary is about 75 to 100,000 pounds per annum, which will probably be about £4,000 to £4,500 a month take home salary. And you might at best spend about £2,000 to £2,500 a month. So this is your basic salary, and it will go up. So here, for doing your post graduation, it's a job, and you learn on your job. You do your exams whilst working. You don't sit and do a 3-year degree course like how you do in India. So you work for 3 years, but you will be in a structured training program. Like, for example, if you do your 3-year internal medicine training, every 4 months you'll rotate respiratory, cardiology, GI, endocrine. For the entire 3 years, you'll rotate through various jobs. And those jobs will pay you a monthly salary. And what you do is, at the end of 1 year, you do your MRCP part 1. At the end of 18 months, you do your part 2. And then at the end of 2.5 years, you do your part 3. So that by the time you finish your 3 years, you come out with a degree. And they'll fund you for those training courses. They'll fund you for exams. So your job, your postgraduate training will be a job where you gain your degree whilst working.
Exactly, Pratap. As I want to tell for some of the students after post graduation or before post graduation, when I want to go, I always tell the topic of the program itself is a plan B. Okay, so why I selected this topic as a plan B is a MBBS graduate who wants to clear NEET PG, MBBS graduate who wants to go to USMLE, MBBS graduates who wants to go to UK or any other foreign countries like Australia, New Zealand, Canada. What next to be done, like that, if they have. So preferable, what as per my suggestion and my experience, preferable always to finish your MBBS. During the MBBS itself, plan for your PLAB, or also plan for your NEET PG or exit exam or next exam, whichever comes nicely, go ahead. Okay, so it is not always you finish, because when always I will tell my dear friends, when you have when you are being like two girls are roaming behind you, and you want to select best of the two, it is always good. If you are roaming behind one girl, or one girl is roaming behind you, have no choice. That's how I always tell, please think outside the box. Don't think of roaming behind one girl or one girl is roaming behind you. Some network issues. I think roaming behind means network is coming to the problem. I think. See, when you have a plan A, plan B, if both plans are successful, you will be really successful. So before a post graduation or after the post graduation, I always prefer to tell before the post graduation. Little bit fear will be there, definitely. That's where the alumni plays a role, as Pratap rightly told. The support, the guidance, and the real guidance, which is a real boost for anyone. And Pratap, how much to be spent for IELTS, PLAB 1, PLAB 2 exam? What is the rough cost, Pratap? Pratap, able to hear me? Pratap, are you able to hear me, Pratap? I think some network issue has happened. Some of the questions are there. Request Pratap to come back once the network issues are solved. Thank you, Sandosh. You will create ripples again. Thank you, Sandosh. And for people who are subspecialties like neurosurgery, what are the ways to get into the UK? Should we give PLAB or FRCS? What FRCS would be enough, sir? Pratap, are you there? PG seat in UK, I think Dr. Pratap have explained about it. It is like you work and you learn and acquire knowledge. That's how it functions. I think study material has been already mentioned for IELTS. A lot of materials are available. So all those study materials and what is the book of choice for PLAB 1, how to go for a PLAB 2, what are the social medias and things available will be available in a website www.conceptnext.in, which will be updated shortly, my dear friend. Which should be wiser and better, PLAB after UG or MRCP after PG? I told you yearly, you can choose either of this, but whichever yearly is always better. Later on, we will become comfortable for the situation. Yeah, list of the books will be added, doctor. Can we give PLAB without internship? Yes, PLAB 1 can be given without internship. You need your pass certificate. What happens after 1 year attachment? By the time you will get your posting also. Okay, you have to search for your job. Also make a video for USMLE. Definitely will make a video for USMLE, my dear friend. Even I am a USMLE topper. I have scored 1 and 2, step 1 94 and step 2 97. I will get up people from US or Canada who have cracked the USMLE and settled there for this program. Earning, I think, explained by Pratap nicely. Sir, Sadish sir, yeah, scope for already you are a big boss. You want to scope for US? Dr. Pradeep Kumar, don't be selfish, Dr. Anton. No, my dear, why should be a selfish? This is the program is really dedicated for an undergraduate student. There is no selfishness here, my dear. How much does it really cost? That's where the problem happens. Network issues for Pratap, I think. Future pediatrician in UK, Naresh Kumar. Welcome, doctor. Naresh Kumar, I think Poda Patrike Paityakara. Thank you, Naresh. This is for doctors. I think you are not a doctor. After PG, should we write PLAB or is there any other exam? Yeah, I think Pratap has come inside. Welcome, Pratap. Welcome back. After PG, should we write PLAB or is there any other exam? If everything is a PLAB exam only.
Yeah.
Pratap, I think Dr. Vijay Bharat's question is a little bit, I think you can explain whether they have to write a PLAB or they can take a fellowship and without PLAB exam with IELTS score alone. Please enlighten. Even a neurosurgeon have asked what to be done after a neurosurgery post graduation in India. Please enlighten it, Pratap.
Yeah. So PLAB route is usually best for candidates who are coming straight after MBBS. So if you've already done your post graduation in India, one of the easier or better ways to come is using your fellowship scheme, where there are fellowship offered by all the Royal Colleges depending upon what specialty you choose, and it's a 2-year fellowship, and for that you don't need PLAB. All you need is your English language exam, which is either an OET or an IELTS UK VIS. So as long as you clear one of the two and you have the basic minimum criteria that you satisfy, then you can come straight through that, and that's probably the best route. But PLAB can be done by everybody, including undergraduates after your PG, after your super specialty. Everybody can go through the PLAB route and come in and then apply for a job in the UK. For those who want to skip PLAB, then a fellowship is the route. Can you hear me, Anton?
Pratap, I have heard news that people who cleared, who had experience in accident and emergency, and being certified for that, they can enter into the UK without a PLAB exam. Is it so?
So there are lots of specialties where, depending upon the shortage of doctors in certain specialties, the government creates options like that every now and then. So accident and emergency is always one area where there is a shortage of doctors in UK. So if you want to be trained in accident and emergency medicine, either as fresh after an undergraduation, or you want to come in after having done MD general medicine, you want to do a specialist in acute stroke critical care medicine, then you can come in directly without PLAB. And there are certain areas where it's being put down by the government as a specialty in need, where there aren't many people, and accident emergency is one of them.
That girl has done a right job, I think. So there are a lot of shortcuts also there, I think. And I request Pratap, please create a blog about the content which we have discussed. Definitely, it will be useful for many of the students and residents. And one point which I want to highlight here is in Tamil Nadu, the doctor population is ratio is 1 in 670. For every 670 doctor, 670 patient, one doctor is available, which is very less. Even it is equivalent to the Finland statistics. So I personally feel the doctors in Tamil Nadu should know about the Plan B. Then only they can live their life comfortably. Okay, the entire Plan B program is created for that purpose. I request you personally to give a blog. What are the places like accident emergency, CBA, the shortcut without PLAB.
Yeah.
If somebody are really want, they can go and enjoy their life. And the comments are, we can have a MRCP while doing postgraduate MD in India. I think you can throw some light.
Yeah, you can do all three parts of MRCP, MRCS. All of these exams can be done. And if you have done those exams, then yes, you can directly enter into a higher specialist training, do your, like for example, I recently sat down on the interview panel for hemato-oncology higher specialist training, where there were overseas graduates who had done their MRCP, and we recruited some of them into the training directly for higher specialist training. So it's possible, and it's important to choose your right specialty. Medical specialties are generally slightly easier to get than surgical specialties. And if people are interested in medical specialties, then using your alumni network, try and approach people of that specialty who can guide you as to how to set up your portfolio. So once you've done your MRCP exams, you can apply directly for a higher specialist training.
So one of our senior has asked, what is the scope of ophthalmology in the UK, Pratap?
Ophthalmology is one of those specialties which can be a bit difficult to get into. You can be trained in retina or a cornea fellowship. You can get fellowships, but to enter into a career program in ophthalmology is quite difficult generally.
So I'm saying, if he's ophthalmologist, he want to practice in UK.
Oh, that is possible. They can come, they can practice. You have a training grade or a non-training grade. Non-training grade, you can do almost everything that a consultant will do. And once you have ophthalmology, post-graduation, most people who come and be ophthalmologists in UK from India are all people who've done their MD, MS or DNB in ophthalmology, or diploma or MS or DNB. And you come here, work for a few years, understand the system, and then you can get a job and work, as an ophthalmologist in UK. So that is quite a lucrative field to come into. If you don't want to end up being a consultant, but want to work, earn, and have a good life, then that's not a bad specialty to come into.
Okay, Naresh, no issues, Naresh. I think Naresh has apologized. After this, we have discussed, I think, if is FRCS with the Ielts enough to get into UK, how should I approach, sir?
Well, once you've got your FRCS, then I imagine you've done your MS along with it. So you've had your surgical specialty training, and what you're applying in UK is for higher specialty training, like for a hepatobiliary surgery, or upper GI surgery, lower GI, or endocrine, or transplant surgery. If you want to get into a higher specialist training like that, then an FRCS with Ielts is the basic that you need. If you have done your PLAB, you boost your opportunities, but you don't have to. If you want, the way without PLAB is getting into a fellowship scheme and then coming through that. But if you want to get into a higher specialist training, then you need your PLAB.
Okay, Pratap, next question: which path will be good after PLAB or after MRCP?
That depends. If you want to come and be trained in the UK, and you want to become a consultant, you want to settle down in the UK, you're looking at a long-term option, then PLAB is the best route. Whereas you want to come there, you want to gain a bit of exposure, look at how another country, sees patients, learn a slightly different system of medicine. For example, do a little fellowship in transplant surgery or laparoscopy or rheumatology or a short period, then try and do it without PLAB. But if you want to look for a career here, come here with a long-term approach, and PLAB is the best route.
Okay. Exam fees, I think that where network issues started. Please, IELTS.
1.2 lakhs, Anton, to clear your IELTS, PLAB 1, PLAB 2. That's the
all three together 1.2 lakhs.
All three, yeah.
Yeah, I request some of the UG students, please, again and again, I will be requesting, after 18 years, you have a right to cast your vote. Please don't depend upon your parents. Try to learn, as you learn, try to earn also. Okay, there are small things which you can earn as a first MBBS, please leave it. Second MBBS, you can be observer in some of the setup, or you can, there are a lot of ways. You find out, earn in a right path, okay, and have your savings. Don't rely on your parents. So that's the thing which I want to convey, dear students here. And research papers, anything to be published?
Nothing.
And as a urologist, I have an experience of 5 years of experience. Pratap, I think a question from my side. What is really, if somebody I wanted to work for like 6 months, or is there any options like that available? Visiting and coming to India.
Yeah. No, definitely. For people who have done their post-graduation, who've gained their experience, who want to come and just experience a different setup, that is always possible. And as long as you're not looking for a long-term commitment, if you're coming there for 1 or 2 years, it's quite easy. Like, for example, this is where network connections and contacts are huge.
Exactly.
If you know the right people in the right setup, then you can create 6 or a 12-month job where you can come work in a particular aspect of urology that you want to work in. Like in the hospital where I work, they do very cutting edge robotic urology surgery, and they're one of the internationally renowned centers for robotics in urology. So we are one of the best centers in Europe. So people come there for 6 or 12-month fellowships. And fellowship, in the sense, you come here, you work as a urologist for 12 months. You do everything that a urologist does. So you will have the same on call, you'll have the same 9 to 5 working pattern, but you'll work in a certain area. If you want to do a bit of research while you're working, you can do that. That's actually quite a good thing, which a lot of people are doing these days, just to have a different experience.
Definitely, Pratap, please put a seat for me. Probably after 2 years, I may come.
Definitely.
Because really, I cracked USMLE, like visa rejected. There is a different scenario. My inner heart says the place which I have not explored. I never thought I will be a consultant at Madras Medical College. After MCH, I was a consultant in Madras Medical College for 3 years. At least now my heart is beating. Yeah, learn something like robotic really is upcoming in India shortly. So probably after 1 or 2 years, I may need your help, Pratap. And I think last question, after full registration with the General Medical Council, you said we have to apply for jobs.
So you apply for the job that you want to get into. Like, for example, you apply for a pediatrics job if you want to go into pediatrics. If you want to apply for internal medicine, then you go into internal medicine, you apply for internal medicine job. So at an undergraduate level, you've just finished your MBBS. So just because you applied for a first job and got a first job, if you don't like medicine and you want to do pediatrics 6 months later, it won't be counted against you. But if you've done if you've done 3 years of post-graduation in India, then come here, and then say you've done in medicine post-graduation and you want to do surgery here or do OBG or pediatrics, then it will be looked as bad. But if you are at a very basic level, then you're allowed to do a job. People do that very commonly here. 6 months they do one thing, another 6 months, and then they decide what is right for them and then apply for a long-term job in a particular specialty.
Wonderful session, almost a lengthy session. Definitely whoever have seen this program, 100% they will be enjoyed. This is a Plan B program for doctors. This design is done exclusively for doctors because many are they don't want to, they are worried about some certain things when they are reading, and when they want to do things, the guidance is lost, so years are lost. So this program is mainly designed. Future, many more programs are going to happen. Okay, for USMLE, for Canada, for New Zealand, etc. Anything, and how to be a successful doctor, how to be a successful like a SPM consultant at India. So many programs are also being planned exclusively for benefit of doctors. Please make use of it. And had a wonderful discussion, my dear Pratap. Last word about Pratap. Pratap is a general secretary of our batch, 98 batch, Kilpauk Medical College, and our batch council president. And he has a lots of women's way to handle anyone. I really love the way he administered. He took his council, I can say, rather than I also was part of the council, but I can give the credit because as Pratap council, when we conducted Pradarshini after nearly 5-6 years, one of the grand intermedical sports and cultural event, which was like a stepping stone after so many years. We suffered a lot, we learned a lot, but I can give a credit to Pratap. He did a wonderful job in managing that crisis situation. Then now, even now, the Pradarshini is non-stop continuous event at Kilpauk Medical College. Thanks a lot, Pratap. Thank you very much. God bless you, my dear.
Okay. Bye.
Bye, Nanba.
Bye. Thanks.
Valga. Jai Hind.